While multiple states across India continue to report a spike in COVID numbers. On New Year's Eve, Maharashtra reported more than 8,000 cases of COVID, of which over 5,000 were from Mumbai. West Bengal and New Delhi reported around 3,451 and 1,796 cases respectively. The country also witnessed the highest single-day rise in Omicron cases. In fact, as per the latest tally, there are around 1,431 cases of Omicron that India has recorded so far. 488 people have been discharged who were Omicron positive. And amid major COVID spike, the centre has written to states. Union Health Secretary Rajesh Bhushan has asked all states and union territories to ramp up testing and set up round-the-clock rapid antigen test booths. In the letter, the ministry stressed any person with fever, with or without other symptoms such as headache, sore throat, breathlessness, body ache, loss of taste or smell should be considered a COVID suspect and must be isolated. So this is the advisory which has been put out by the centre to states at the moment. Two-pronged advisory. First one, of course, is to ramp up testing. Centre has written to all states and union territories to do that immediately, set up rapid antigen booths wherever possible. But the other thing that the centre has in fact said this time around, which is new, is the fact that it has in fact told the states that at this point in time, anyone who has fever or has some of these other smaller symptoms, need not necessarily be just COVID symptoms, should be treated as a suspected COVID case. I'm joined by my colleague Alok Singh for more on this. Alok, so this is an extra measure of precaution which is being taken by the centre by writing to states on this particular advisory, essentially saying that at this point in time, anyone with fever or symptoms of fever should be seen as a suspected COVID case.
Yes, Tanima, in fact, this advisory is very important because the centre government tries to make the people understand that if you are affected with any kind of symptoms of the COVID, then think it and consider it as a COVID symptoms, means think it and consider it as a COVID disease. And isolate yourself immediately. In fact, if you see in this advisory, they have said two things. One, that if you have any kind of symptoms, immediately start considering it as a COVID suspect and isolate yourself. And the second is the states, the administration, they have to set up antigen test centers. These antigen test centers should be set up in the government and private hospital. Remember, these rapid antigen test kits, in fact, give you result in within 10 minutes. However, if you go for the RT-PCR, it gives you result with 8 to 10 hours, and sometimes it takes more than 24 hours. So that is why this gives you result immediately, and that's why the central government has said to the state governments to set up this rapid antigen test centers at government as well as private hospital. So definitely the state governments will also start doing this. But right now this advisory is very important. Back to you.
That's right. As you said, that this is an advisory which has been put out by the centre to states amid Omicron concerns. As we said, around over 1,400 cases of Omicron which have been reported in the country so far. Alok there, thank you so much for joining us with that.